Hello, everyone. Welcome back to the EDC Symposium. We hope you had a good break. Now we would like to start on a panel that I'm very excited about. My name is Maggie Snyder. I'm a lead public health advisor in the Office on Women's Health. And I'm excited to present a panel on the HHS Endocrine Disrupting Chemicals Innovator Award Competition. The panelists are Phase 1 awardees from the challenge. This challenge was from the HHS Office of the Assistant Secretary for Health, Office on Women's Health, as a national competition to identify innovative programs that address gaps in knowledge and provide solutions to reduce EDC exposure risk with a special focus on Black or African American women. Now, any questions that you have, we greatly encourage. Please put them in the chat and we will address them at the end of the panel. Now, we will start off with one of our panelists, Alexandra Dessler from Safety Nest. Go ahead, Alexandra.
Thank you for the opportunity to be here today. I'm Alexandra Dessler, Safety Nest founder and CEO. Safety Nest is a small startup benefit corp. Our mission is to dramatically reduce the incidence of preventable diseases linked to toxic chemicals and safeguard future generations so they can grow and thrive. I'd like to take the next 5 minutes to talk about why I started Safety Nest, what I've learned, how we're using the HHS award to reach women and improve health outcomes. I'll begin with why I started Safety Nest. There were 3 sparks. The first spark was when I was writing a paper in grad school and I stumbled upon the alarming statistic that there are 85,000 plus chemicals that surround us, with very few tested for safety. I was stunned. The second spark was when I became a mom. Knowing about the tidal wave of toxicity and not being a chemist, I became very frustrated by how hard it is to know what's safe and what's not safe. And it surprised me that the majority of women I met and continue to meet are unaware of the risks posed by toxics. I've since learned that early life exposure, even in small amounts, can have harmful effects across the full lifespan. And as you know, EDCs are a major culprit impacting fetal development and are associated with gestational diabetes, preterm birth, among other negative health outcomes. I also now know that this area is replete with health inequities, as many chemicals disproportionately impact women of color and underserved populations who don't have equal access to health messaging. The third and final spark that ignited Safety Nest was a report I read from UCSF. The takeaway is that reproductive health professionals typically don't have the training tools or expertise to counsel their patients. It struck me that we're missing an enormous opportunity to educate all women when they are uniquely poised to make behavior change for the health of their pregnancy and baby, and equip health professionals with tools so this topic becomes a routine part of care. That's what Safety Nest is working on. I got started with an earlier version of Safety Nest, creating a simple beta site allowing women to navigate through graphically displayed rooms in a home. We got some traction, but also didn't hit the mark. With the HHS award, we've gone back and asked women and health professionals what they need from Safety Nest. We heard that women want trusted, evidence-based guidance. They want to know what the most impactful changes are that they can make and get that in short nuggets. Women want us to meet them on social, Instagram being a favorite. It's got to be relatable with the content being presented by different and diverse voices. And women want safer options that are affordable. We took what we learned and are developing a new online community focused on top changes for a healthier pregnancy and baby. The site has our branded cheery and engaging graphics as well as animation to help diffuse the fear factor that's common when you take on this subject. I'd like to walk through some features we're developing to support women and new families. Core to our brand is presenting top-tier information from the most credible sources in a way that's relatable. The Safety Nest original content will be delivered via small chunks focused on what you need to know and safer choices that are actionable. And the content is delivered via a variety of media, which you can find by searching by room, chemical, specific item in the home, media type, and other common tags. We've also developed a proprietary tool called the Betterness Score. Safety nesters are invited to take a brief environmental health quiz, which results in a personalized score and custom action plan. The action plan presents the most impactful changes a woman can make in her home to reduce her exposure to toxic chemicals and better her nest based on where she lives, current behaviors, and lifestyles. We hope the Betterness tool will support health professionals integrate environmental health messaging into preconception and prenatal care. Next, we're piloting a wellness market to offer women and new families an online directory of vetted and mission-aligned pregnancy and newborn-oriented practitioners whom they can access locally. In addition to our existing social covering EDCs and other quick tips to reduce exposures, we're building out a series of short video interviews with diverse subject matter experts. This is part of a reinforcing strategy across safety nets to build awareness and expand our reach to all women and new families. On the resources front, Safety Nets will serve as a repository for trusted external content, where you will showcase and push out the wonderful work of our colleagues in the field, including many of you. And we will highlight the best ways for safety nesters to find safer products. Finally, be the change. Since we know we can't wash away this tidal wave of toxicity without serious policy change, we're providing safety nesters with suggestions on how to engage in local and national action to advocate for fair environmental health and protection policies. The goal being to change the marketplace and policy so all women and families are safer. We're spending the rest of the summer listening, learning, and building the Safety Nest community with plans for an early fall launch. I'd love to hear from you, so please reach out and follow us on social. Thank you to the Office of Women's Health and all of you for this opportunity.
Thank you so much, Erin. We appreciate everything that you've done in your project and the great work that you continue to do. Next, we'll move on to Robin Dodson from the Silent Spring Institute. Robin, take it away.
Hi, thank you, everyone. So I'm here to tell you a little bit about a project that is supported by the Challenge Fund. It's called the Power Project. And this project was designed really out of kind of an acknowledgement that we know that Black women in particular are disproportionately exposed to EDCs and impacted in the health, have disproportionate health impacts. So this project started a couple years ago when we started speaking with Black women about what was influencing their product choices and how we could design an educational program to address specific concerns around EDC exposures. This work is, while I am providing as an environmental exposure science, the research expertise, this project is very much led by postdoc at Silent Spring, Dr. Alicia Franklin, and it's done in collaboration with our colleagues at the Resilient Sisterhood Project. And we've come together to kind of join forces with the the research backing up the recommendations, and then of course the Resilient Sisterhood Project's RSPs connection and speaking with Black women about reproductive health issues. So what this project aims to do is to actually reach Black women where they are. As Alexandra just said, a lot of women identified in our conversations with them that they often look towards social media, in particular social media influencers, to learn more about beauty products. And so we designed a project that is working with, in collaboration with, social media influencers. So what we did is we actually pulled together a team of social media influencers, first identifying about 50 of them, and then actually contracting with a team of 10 social media influencers to develop content to reach Black women about EDC exposures. Now, I want to say the importance of doing it in this particular approach is that we decided not to necessarily develop content and push it out through our own networks, nor do we decide to develop the content and then ask others to push it out. But this is a unique approach in that we are working directly with social media influencers for them to develop content that uses their voice and their aesthetic and their way in which they have a unique way of connecting with their followers. So with this team of 10 social media influencers with a combined following of over 700,000 Black women, we asked them to attend an interactive and informational workshop with us where we shared information about EDC exposures and recommendations or evidence-based recommendations for reducing exposures. We then worked with them to iteratively create content and post content into two areas in their social media, depending on what platforms they were using. Then we asked them to share a survey with their audience, and then we gathered that information to look at the audience feedback and analyze the analytics. So here I want to share some of our really successful posts that went out. So this is work that we did collaborate. This is Dr. Ijamakola. She's on Instagram, and she put together this post that I think really kind of speaks towards and is within her kind of own voice and aesthetic. It's, first of all, it's beautiful. She shared some of our recommendations, but did so in a very personal way, actually calling upon her own kind of issues with fertility. And this was hugely successful, viewed by over 25,000 women. And the number of shares in particular is really exciting because it means that folks were, who knows, kind of where they were putting out this content and how big our reach actually was. Some other content that encourage you to check out happened on TikTok or Instagram, even LinkedIn. Dr. Corey actually had quite the impact on LinkedIn. Again, sharing some really kind of detailed information, but also in a personal way that really reached and resonated with their audiences. And what we found actually was that we were having an impact. In fact, 74% of the followers that completed the survey said that this increased their concern about chemicals and products. 83 said that while they had previously heard about chemicals and that they may affect health, and 43 reported saying that they were going to start avoiding chemicals of health concern in the products that they purchased. And we really got some nice feedback and personal feedback around the importance of sharing the information in this way and how the audience was really connecting with this information. We reached over 100,000 women, again, with over 1,400 shares. Again, we can't even kind of quantify that potential impact there. But it is really remarkable, I think, the extent to which we are able to get this information out in a way that is really resonates with the followers. So our next step is to actually evaluate the effectiveness of this approach. We're actually going to team up with another group of social media influencers to develop content to be posted and then actually do some pre and post surveys to evaluate changes in environmental health literacy among the followers of those social media influencers. So look forward to sharing that information on a future webinar. And if you'd like to contact us, and of course on our website, you can learn more about the projects, both at Silent Spring and RSP. Encourage you to check out our websites and find us on social. You can learn more about this Power project, including the QR codes and other links to all the content that was developed for this project. Thank you very much.
Great, thank you so much, Robin. This is really valuable work that you're doing, and you're reaching so many people. We're glad for that wide-ranging reach. Next, the next awardee is Emily Hills. Emily, please go ahead.
Hi, thank you so much. I'm Dr. Emily Hills, and I am a postdoctoral researcher at the University of Texas at Austin. I've also founded Endocrine as a method to try and increase Black women's awareness of EDCs and personal care products. I just want to take a second to thank the organizers for putting together such an awesome symposium that I think is really highlighting why this is such an important mission being put on by the OWH. So I'll just hop right in. Oops, sorry about that. Okay, for a little background, public perception of the risk associated with the use of EDC-containing products is low, and this is in part due to low awareness of personal routes of exposure, particularly considering personal care products like skin creams, hair products, things like that. And as we've heard, Black women are disproportionately exposed to EDCs via these targeted care products. Marketing campaigns take advantage of socioeconomic factors or socio-environmental factors like natural hair discrimination, colorism, and stigma surrounding feminine hygiene to sell Black women products that contain EDCs like chemical hair relaxers, skin lightening creams, and vaginal douches, all of which can contain and be a significant source of EDC exposure. Since reducing our exposure to EDCs can significantly improve health in women and their children, increasing Black women's awareness of EDCs in their care products and empowering them to choose products with less EDCs can really meaningfully impact health in that community. This is what I developed Endocrine for. Endocrine is a mobile app on the web that is used to increase awareness of and reduce exposure to EDCs. It functions as a database of known or suspected endocrine disrupting chemicals along with their health impacts, and it's used to scan product ingredient labels and reports back to its users information about potentially detected EDCs along with their associated health outcomes. The app is designed with education in mind, and we reach the Black community by partnering with brand ambassadors, business owners, and community leaders here in Austin, Texas. We also integrate user feedback to make this an evidence-based approach, getting non-identifying information and understanding patterns of use, demographics, and improving the app to work within this community context. So a little bit more about these features. Needing a robust and reliable database is incredibly important for an EDC scanner app. We built our database after the 2019 Deduct EDC database. The way we did this was pretty cool. We collected the papers included in Deduct and then trained a learning algorithm on that. We then applied that algorithm to the entirety of PubMed to identify potential EDC research papers that connected a specific chemical with a health outcome. From there, we removed duplicates that were already contained in EDC databases and manually screened these leftover papers to identify specific chemicals associated with a health outcome. And ultimately, we added about 1,300 papers to our EDC database for a total of 14,000 approximately 14,000 peer-reviewed research papers and 861 unique EDCs. From there, the way the app works is pretty simple. It captures a photo of a product ingredient label and then using technology called optical character recognition, converts text from that picture into a machine-readable format. It references that against our database and provides a report back to the users about any EDCs that were detected in that image. This includes information relating that EDC with its known health outcomes, as well as providing the number of peer-reviewed articles from where that information was collected. This is an important point because it addresses uncertainty about EDCs without undermining user confidence. Users can decide for themselves if this is enough evidence to inspire them to look for a better product. We also include educational features like what EDCs are, some of their important health impacts, and tips for avoiding them, not just in personal care products, but in the environment via methods that have been discussed pretty extensively so far. In later releases, we want to help users track their personal exposure and watch that exposure reduce over time. Endocrine is designed to be used by any person in any circumstance because EDCs are a worldwide problem. But we are working specifically to reach Black women and members of their and other disproportionately exposed communities via an outreach campaign that is both online and community-based. Online, we're working with brand ambassadors and collaborating with brands and influencers to try and start a viral social media campaign. And In the community, we're reaching out to local businesses and advocacy groups, as well as attending any relevant health meetups and events to try and get the word out, as well as learn more about how we can better serve the community. So I just want to end on a few notes. Endocrine is unique because it works independently in real time. It has no need for manually databasing individual products or have back-end screening staff going through products labels or testing chemical components. There are strengths and weaknesses to this approach, but I think one of the big strengths is that we can work with great speed to address things like regrettable substitution, as well as the constant influx of products that are being put into market all the time. We're evidence-based. We rely on peer-reviewed scientific literature and communicating that research accessibly to a community that might not otherwise be exposed to it. And we also try to do that in this community context. And we're also live. So you can visit endocrine.org or scan the QR code to view our beta. We're still working on adding some of these final features, but we're hoping to begin that outreach campaign in earnest starting next month, which is really exciting. So I just want to take a moment to thank the HHS Office on Women's Health for funding this project. Again, I am Emily Hills, and my invaluable team, Robert Purse and Forrest McDonald, really made this possible. I'd also like to thank my mentor, Andrea Gore at the University of Texas, for teaching me about this really relevant issue and empowering me to get kind of out of the lab and into the community to really, try to help people. So thank you for your time. Please feel free to reach out to me if you have any questions.
Thank you so much, Dr. Hills. We appreciate your presentation as well as your great work helping women, particularly Black and African American women, to address EDCs. Next on the list, we have Dr. Tiffany St. Bernard from My Hair Days. Take it away.
Hi, everyone. I'm Dr. Tiffany St. Bernard. I'm also a postdoctoral research fellow at Cornell Tech and founder of Hair Days. I'm actually just going to talk to you today instead of having a presentation. But yeah, I wanted to first talk about the background and inspiration behind Hair Days and what we're doing and how we're helping women and Black women avoid endocrine disrupting chemicals in their hair care products, and then talk to you a little bit more about our technology and our vision for it. As I mentioned, I'm Dr. St. Bernard. I am very passionate about solving big problems that are often overlooked, and hair care and scalp care is one of those. And as we've been talking about today, endocrine disrupting chemicals is something that is not really commonly known or talked about in various communities, especially my community around Black women. We are building at Hair Days an AI-based solution that is able to help individuals, scan their hair and scalp health and map that to best suited products and recommendations, and also insights on the health profile of these ingredients so that they can navigate this crazy world of products and hair care. As our fellow recipients mentioned, that there's a disproportionate amount of endocrine disrupting chemicals in Black women's hair care products. And historically, there's been a push towards using more natural approaches, but more and more I'm seeing in the industry that individuals are reverting back to old practices because of convenience, because of discrimination, as mentioned earlier. And so our platform is actually a community-based tool where we have around 50,000 women on our platform that are there for educational information, but also to help track their journey. So the benefits of our tool is that we're not only helping individuals be able to get insights on educational insights on endocrine disrupting chemicals that are written by experts like dermatologists, trichologists, cosmetologists, like all of the ologists. So basically, these are research-backed, validated insights that follow a similar format to Instagram stories. So they're bite-sized information around ingredients, healthcare practices, so that they can find information in a very digestible way and be able to integrate it into their lifestyle practices. The benefit of our community-based platform is that individuals are able to also track things over time. So they're able to document their journey and reflect on things and take learnings into practice and learn from one another, as well as the experts. The inspiration behind all of this came from my own health scare. I actually fell ill, very ill, in like 2016, lost a lot of my hair and became allergic to life. And so that actually made me very conscious about what ingredients are in our products and what I'm putting in and on my body. And that I realized that so many people are struggling with the same challenge, and reading labels is definitely a challenge. Even if they do take the time to do that, it's very difficult for them to understand what works best, or what to avoid and what to use, and so on. So our data-driven approach is helpful for automating that process. So I think that's mainly about the background. And so a little bit more about, I guess, the underlying technology is that we're combining computer vision analysis solutions with a large language model or AI-based recommendation system that uses, or the input for that is like primary literature, books, and research-backed information that is fed into our system to train our AI to be able to provide these insights and recommendations. And I'm not talking about just like product recommendations. I'm talking about insights and educational information as well. And with that, I would love to open the floor to say that I would love to collaborate with any of the grant recipients. I think that the work that everyone here is doing is phenomenal, and I see ways that we can work together to make our impact even larger. And I'll stop there. Thank you.
Great. Thank you so much, Dr. St. Bernard. We're grateful for your work.
Yeah.
Next, we'll move on to our next awardee, Dr. Greg Hall from NIAAH. Take it away.
Thank you very much. I'm happy to be here representing the National Institute for African American Health. We're going to talk about some of our endeavors. It's really amazing work that people are doing here today. It's really inspiring. Well, we took a multi-pronged approach to educating about ADCs, including the physician or clinician education, using an online resource, which again we've talked about, trusted resources online, video education with social media, podcast interviews, and the community partnerships. And so I'll just run through each of those. Let's start with the provider education. Pri-Med is a national continuing medical education company that's based in Boston, Massachusetts, and it has a reach of a database of 160,000 physicians, nurse practitioners, and physician assistants that come to get their continuing medical education credits so they can kind of keep their licenses up. I have a episode called, actually a recurring episode called Bridging the Gap that looks at specifically at the healthcare needs of African Americans. And so in April, I basically presented on endocrine disrupting chemicals to over 800 people live. And then once you present on Pri-Med, it becomes on the database. So if you're not available during the day, anyone can kind of sign on and watch the videos and get continuing medical education credit at night or on the weekends or whenever, basically when I get mine. But if you want to watch it live, you can then ask questions. We answer questions as we go. And so that was in April. Very good response. We talked about all the issues, the clinicians need to know, some of the chemicals, when we talk about, African American women don't know this, don't know that. Clinicians don't know a lot of this information. They have no idea about the risk, no idea about breast cancer risks or attention deficit. I mean, there's a lot of new information out there. And so as you educate the providers, they can then educate their patients. In terms of online access, nia.org is available for basically trusted information. A lot of people know the Black community is not not trusting of public entities, not trusting of people selling things. And so NIA.org is a website that has no ads. It takes no money. It's a nonprofit basically, and we're just trying to help spread information. And so as people share the articles that we have on there, they'll drive more traffic. We've also have a presence, as mentioned, the other companies have mentioned, on social media, where we're getting a good follow in terms of really educating people about plastics and things of that nature. We're also on Instagram, really just increasing information related to makeup and things of that nature. We also had 3 videos produced, specifically produced by a Black company with all Black members. A longer video done, really educating on screen 5 African-American women about EDCs and kind of seeing their reactions as they learn about it and talk about it, how does it make you feel and things like that. And it's really very good. It's a longer format, but it really works well. Another one we did with 2 women, split screen. One took one course in terms of their beauty and makeup. Another one took another and really talks about the different dynamics of those choices. And then another one is just hairspray, really a scene in a beauty parlor talking about as the beautician is educated by her clients about some of the products that she's used. And so these, again, they're all sort of uplifting and educational and everything, and people are showing a good response to that. We're sharing those on social media and on our website as well. We've also done 2 podcasts with my podcast, Better Black Health, which has a great following. We did one on, we've released one, hormone disrupting chemicals. Once that one runs its course, we'll release the second one, even though it's already, the interview has already been done with a PhD African-American woman who know really researches in endocrine disrupting chemicals. And so we have our community partnerships. The She Foundation is having its national gathering next week even. And so they're going to reach out to hundreds of women there. We've also partnered with our local National Congress of Black Women, and our even more local Richmond Heights, a suburb around Cleveland, their health consortium in terms of getting information out there as well. So National Institute for African American Health, multi-pronged approach, really inspired by what we've heard today, and look forward to seeing you out in the community. Thank you very much.
Thank you so much, Dr. Hall, for your presentation and your wonderful work, especially your involvement with the community. We know that community input is particularly important for this issue. Our next awardee is Erin Spicer with the Hackensack University Medical Center. Take it away, Erin.
Good afternoon. My name is Erin Spicer, and let me just start the slides here. I'll be presenting on the New Jersey Healthy Salon Workers Training to reduce EDC's exposure risk among Black women. Our goal is reaching the next generation of cosmetologists, and I'm very thankful to be collaborating with Tracy and Bethea from Georgetown Lombardi Comprehensive Cancer Center and Derek Schendel from the New Jersey Safe Schools Program at Rutgers School of Public Health. So as many have talked about today, by way of background, hairdressers and stylists, barbers, nail technicians, estheticians, and other salon professionals work daily with a wide variety of chemicals, many of which have hazardous properties. Research to date has documented that chronic exposure to chemical toxicants currently found in hair and nail preparations can cause adverse health effects such as contact dermatitis, asthma and allergies, and may increase risk of cancer and negative reproductive outcomes. Hair care and styling products are particularly important as they include chemical relaxers, bonding glues for hair extensions, and other products containing chemical mixtures, a potential toxic soup of ingredients not tested for long-term health and safety. To date, there's no known cosmetology training program for Black African-American salon workers, including both content on the health hazards of EDCs and how to protect oneself from exposure in the salon setting. So to help protect the safety and health of these future cosmetology workers and their clients, we created 2 educational modules on EDCs that have been added to and will be assessed as part of an existing training through the NJ Safe Schools program from Rutgers School of Public Health. Unit 1 introduces the racial ethnic disparities related to salon products and practices that lead to disproportionate EDC exposure among Black and African American women. Unit 2 focuses on steps that students can take to protect themselves from EDCs at work, including alternatives to common EDC-containing products and how to educate future owners, supervisors, and clients in the salon. This is a screenshot of the NJ Safe Schools program, and this is accessible from the homepage, which links to cosmetology, safety, and health for teachers and educators, and for young professionals. So our team developed content pages, information, photos, and other visuals with sources, and links to websites and PDF files that were integrated into the Rutgers Canvas Learning Management System, which is an asynchronous online learning platform. 5 teachers have so far completed a preview pilot in the spring and this summer, 3 teachers in Somerset County, New Jersey, and 2 teachers in Essex County. The full rollout with students will occur in the fall, followed by data analysis of the assessment measures. So here you can see a screenshot of the lesson objectives, and this is right from the Rutgers Canvas Learning website. And this is part of what students will see as they go through the course. This is a screenshot of the organization of content in Canvas. So there are many sections. This is just showing a few of them to give you a taste and a flavor of what the full course offers. We also included additional resources for students so that if they're interested in learning more about a topic, they have a wide range of resources to choose from. So here you can see a screenshot of just a few of them. At the end, we include a case study for knowledge assessment to make sure that the cosmetology students really understand the concepts being presented. So I'd like to thank everyone involved with this project, and special acknowledgements to Midhat Raman, New Jersey Safe Schools Program at the Rutgers School of Public Health, and the HHS Office on Women's Health. Thank you so much, and I hope you enjoy the rest of the symposium.
Thank you, Erin. It was a wonderful presentation and really valuable work. We know that any state is a good place to work because every state has EDCs and women who need help addressing them. Okay, our final awardee is Jacqueline Brown with Empowerment Resource Center, Inc. Take it away.
Hello, everyone, and I'd like to thank HHS for putting this on. I'd like to also apologize for my voice. This smoke or haze from the Canada fires have really gotten to me today. So when you hear about Empowerment Resource Center, you may ask why endocrine disruptive chemicals was on our radar. And I will share, as one of the other presenters said, I noticed that in my immediate family and in my immediate church family, bloodline family, coworkers and friends, many of us struggle with thyroid issues. And so that's an area that became of interest to me. So let's talk a little bit about Empowerment Resource Center, one of my favorite subjects. ERC was established in 2003 and incorporated in 2006. 2023 marks our 20th year of operation, so we are just thrilled with being able to have an impact on the community for such a long period of time. ERC is a nonprofit organization with 501c3 status. We are community-based and provide a comprehensive continuum of care for our clients. Our comprehensive intervention clinic is registered under the Georgia Composite Medical Board, the Georgia Volunteer Healthcare Program, where we have volunteer providers and paid staff as well who are medical providers. They provide sovereign immunity for them. And we were recently designated as a DBHDD provider. That's the Department of Behavioral Health and Developmental Disability provider under the state of Georgia. ERC has an accreditation with CARF for its behavioral health services, which is the equivalent to Joint Commission. This map, the red star is supposed to be on top, covers the area that our clients come from. Georgia has 159 counties. We have served clients in about 90 of those. We are located in Atlanta, Georgia. We are a HRSA 340B covered entity for those of you who are familiar with that. So under those designations, we are in the STD realm with Section 330 funds, Ryan White, and family planning. We are part of the Georgia Family Planning Network as well. So we have 3 340B eligible facilities or locations, our clinic here on site. We have a site at the Clayton County Board of Health, which we partner on HIV and mental health services, and our ERC on the MOVE program, which is our mobile fleet of outreach vehicles. We have 3 outreach teams. This silver image is in front of our building. It looks like, forgive me, a silver vagina. That's how everyone finds us. We're in the middle of Peachtree Street, which is the epicenter of Atlanta, Georgia. Again, clients can access ERC either walk-in, telemedicine, or one of our satellite locations. We have multiple contract pharmacies. And what's important to us is healthcare accessibility. So we are relatively new to the Medicaid arena, about 2 years. We accept most private major insurance, private insurances. We operate on a sliding fee scale, and many of our services are grant funded. And currently, we're pursuing federal FQHC status for lookalike designation. The mission of Empowerment Resource Center, I won't read it to you. I trust that you will, but what's important to us is that we provide solutions to improve health-related quality of life. And we feel as an organization that we are privileged to serve certain communities. Our vision is to achieve healthy outcomes one client at a time. So let's talk about our client pool. 39% of our clients are under the age of 29, 44% are uninsured. When it comes to HIV positivity, about 2% are HIV positive and learn their status through Empowerment Resource Center. Our linkage target is 90%. We're at 81.2%. And 15% of our clients come in for repeat STIs. And so endocrines impact the reproductive health systems of many of our clients. And that's what led us to it. If you look at gender, about 31% of our clients are female, which is a stark difference from when we started. Initially, 99.6% of our clients were female. So let's talk about endocrine disruptive chemicals. Through the award that we were granted, we chose to focus on educating Black and African American women, and we focused on 4 targets. To inform on the risk of EDC use. Many of the awardees have already addressed that. Educate on EDC links to cancer and reproductive health issues. We are a specialty boutique for sexually transmitted infections. And so reproductive health and being a family planning clinic is something that our clients need to be aware of and are inquisitive about. We wanted to go ahead and list EDC use products, EDC's use in household products, and share strategies that help to reduce EDC exposure. As research has shown that there's a 39% likelihood of Black women dying from breast cancer than white women. And so I wanted to click on this photo, which will take us to our website. So this is a section that's specifically target in our website to endocrine disrupting chemicals. And as you scroll down, you will see that there's a section that's should you be concerned? And if you click on household products, you learn what products, what endocrines, disrupted chemicals are in, what they look like, what the names are that you can check with your products, and also how to reduce your exposure. Thank you. And if you slide down just a little further, one of our objectives was to click on this external link that has a great tool where you can type in any products that you have and determine whether those are EDCs or not. From our website, we, in the first 6 months after viewing this, we had 35,983 impressions. That's our reach for endocrine disrupting chemicals. Remember, our clients are coming to us for services. Our outreach team is going out for HIV testing, chlamydia, gonorrhea screening. We are providing family planning services. So our population, we get the opportunity to inform them about, excuse me, about endocrine disrupting chemicals. Also, we have had 183,000 Google ads. So once you go to our site, wherever you go to, you see EDC information and ERC as well. So if you'll go back to the slide. So the last slide I'd like you to see here is, this is a community outreach event at Clark Atlanta University. This is two of our outreach teams, the actual HIV prevention team and our behavioral health team. There are 3 HBCUs in the city of Atlanta. And so our outreach teams partner with the universities periodically in addition to talking about HIV, link them to our website and providing information on EDCs. With that said, I will stop there, and my next slide shows contact information. Thank you for moving that for me. I couldn't find my mouse. If you have any questions, again, thank you for this opportunity. I am in a doctoral program at the University of Georgia in public health, and so my advisor and I are debating on whether this should be my dissertation topic. I think it would be a great research topic, as there's limited information led by people of color about this subject. So I'm looking forward to exploring that. Thank you again.
Thank you so much, Jacqueline. We appreciate all of your work and wish you the best in your doctoral program. Sounds like you've got some potential for an excellent subject. So now we will turn to the questions. This first question is addressed to Dr. Hills, but I really welcome any of the awardees to take a stab at it and address this question, because it's just so important. Question is, who or what is informing your project to make sure it is truly addressing the needs of Black women? So any of the awardees who would like to answer that question, please go ahead.
Well, I'll start since it was addressed to me. It is an important question. Obviously, I cannot answer that question for myself, and it's important to work with people who can. So for Endocrine, we've been in research and development for the last 7 months, and we're just about to actually have a functioning app online. And so our next step really is to find members of the Black community who can do that informing for us. So, I've kind of got my meetings set up for after this, and we're going to be using a very similar approach to the Silent Spring Institute, actually, with this influencer-led kind of campaign, but also doing some more on the groundwork here at home in Austin. So that's the plan.
Thank you.
I felt it was important for us to be a voice at the table. If you're not at the table, you're on the menu, so to speak. And so much of our staff is representative of the communities that we serve. Much of our information is designed with that population in mind. We have community advisory boards that research and provide input into our programming. We have a board that's representative of the community. So it's very important to get to engage with the population that you're targeting.
I can speak to Safety Nest is working locally with a couple of organizations, one being a network of doulas serving Black and African American women and other women of color in the Bay Area for feedback along the way as we design features and content for our online community.
And I'll just say we've just been very deliberate about having Black or African American in our name, having a website somewhere that anyone can come to our website, but we know that the vast majority of people going to the National Institute for African American Health are African Americans, where they can get their best information. Trusted sources is so important, to be able to have a trusted source that people know that the information is not a conspiracy. It's not trying to do the opposite of what we're actually trying to do. So, and then, Black women is how you reach Black women, through Black women and Black men as well. But so we're deliberate about doing that.
Similarly, one of our collaborators, Dr. Tracy Bethia, is a Black woman at Georgetown, and several of our staff members are Black African American as well. So we have a really diverse team coming together on this project. And of course, many of the students who take the cosmetology course are Black African American men and women as well.
Great, thank you everyone. Such robust responses, and we appreciate you answering this really important question. The next question is directed at Tiffany. Are you also consulting with scientists and people doing research related to EDCs?
Yes, actually, I am. I have research collaborators that are experts on EDCs specifically, and then I also work with experts like in the dermatology space. So all the areas that we are working to educate our user base on, we definitely work with experts in those fields.
Excellent. Thank you, Tiffany. The next question was asked during Dr. Hall's presentation. Are interventions targeting barbershops and hairdressers, and also how about manufacturers of hair products?
Yeah, so what we're initially doing is trying to educate the people who go to beauty shops, really on social media. I've spoken to a few hairdressers and talked about ways that we could share the videos when they're at the beauty salon, but we haven't really targeted beauty salons as a way. We're really targeting African American women, and they go to beauty salons and then have them do that. But we're open to that. And as another person asked, we're open to collaborate with anyone. I mean, there's some outstanding ideas and outstanding things going on in this field. And I think if we work together, we can certainly reach even more people. So it's really exciting to see what's going on in ways that we can work together and really expand, get this information out.
Excellent. Thank you, Dr. Hall.
Mm-hmm.
Give a brief moment for any other questions that may be coming through at this moment. Okay, there's a question for Dr. Hall. And forgive me if you've answered this already, but do you see the question about the Essence Festival and having NIAAH spread the news about EDCs and the impact of your organization at this conference?
Well, what's funny, and funny, if not funny, ironic, that we have a lot of nonprofits here and small businesses, right? And if you want to be on Oprah.com or the Essence Fest, you got to come with $30,000 and $40,000 and $50,000. And these organizations cost a lot of money. If you want to be on a website where a lot of people are there, you pay through the nose. And so having the capacity to be able to, just the ability for someone to attend the Essence Festival, we have to pay their flight there. We have to pay their hotel. And then we've got to hope that's a good way to reach people. And so we haven't done that because of the cost, really, to be honest with you. But if someone is aware of some low-cost way of reaching a lot of people, I'm sure all of us on this panel will be open to that information, because finding people without spending money is hard. You have to really use influencers, which was a great idea, and also try to find a way to have things spread organically, and that just takes time. I hope that answers the question.
I'll absolutely agree with you. I look back over since ERC's inception. How do you get the word out about your particular subject? And so in the last few years, we've participated, me or someone on my leadership team has presented at different conferences. Last week, we were at the 340B conference that occurs every 6 months, National Association of Community Health Workers. It's getting people to come to your sites, it's publishing your information. We're presenting at the at APHA, the Association for Public Health Associates. So it's hard starting. I remember the journey of coming from being a health educator who just wanted to talk to folk to becoming the CEO. It is quite the journey. But I'm just getting to the point where I'm having an opportunity to present, like at this type of event, or whether it's virtually or in person, is very expensive. And for us, fortunately, it was not go build a website. We had a group, and we have a client base that comes to us. And so it's like, hey, here's an issue that impacts you. Let me share more information on you. Let me put palm cards out. Let me do a pop-up for you. Let me put it on social media. So you can access any of this information through any of our social media outlets. But here, that's a challenge, finding money to be in all the spaces with such a small budget.
Well, thank you, Greg and Jacqueline. These are really valuable answers. We appreciate you doing this to inform the public and to answer these questions as particularly as possible. We have one other question. The question is, why is this related to cosmetology schools, and why are they addressing this? This seems to be open to any awardees. Feel free to take a stab at it.
I think the question may have been related to our project. So Rutgers has a contract with the state to provide cosmetology education to young men and women who are primarily in high school, who are learning to be cosmetologists and studying to get their license to be a hair salon worker, barber, or nail technician. And so our project is a way to get information on EDCs out to them as they're training, so that in turn they can cascade that information down to their clients, maybe their boss in the salon, and the community at large.
Great, thank you, Erin. And just one last question for any awardee who would like to answer. Is there one EDC or one product in particular that you would like people to be aware of, or any really succinct final message you'd like to get out there?
Well, I can say sometimes I'm asked this question as an environmental exposure scientist, what are my kind of top tips for exposure reduction? And certainly, you know, the top one is to try to actually go fragrance free. I think there are a lot of EDCs hiding in the fragrance mix, including phthalates we know are correlated with the presence of fragrance in products. And so choosing fragrance-free products when possible is really important and can go a long way. I also recommend that folks keep it simple. We need to acknowledge that these EDCs in particular can work as mixtures and can have a greater impact. We hear that from the speakers over the last day or so, that the more, you know, these co-exposures, these can really add up for a larger health impact. So keeping it simple, using fewer, more simple products, and going fragrance-free are typically the recommendations that I share.
And I'm just real quick, I'm sensitive to children. So now I go to the grocery store. If I see a little girl with makeup or nails on or eyelashes on, I think about the potential risks there. And, you know, I'm really telling my patients now to, you know, you can, you know, so if someone's having a wedding or graduation and little girls you can put makeup on, probably won't disrupt anything. But really on this daily basis, the pressures in school and social media and all the hair products and things is really getting out of control, and it's moving their puberty forward, which is putting them at increased risk for breast cancer down the line. It's not just to do it. There's actually health reasons that are influencing them. So really, the children is really the biggest thing for me.
I wish that I could get, I remember the journey from going from relaxed hair to back to natural hair. I wish that I could get all the YouTubers to, instead of being so influenced by this product is being sponsored, to actually be more socially aware of the products that they push. And because all of that is not necessary to make your hair behave the way it normally does. It would anyway. So I may be spilling more about what I would love to, my next challenge to be, but that would certainly be my wish if I had the ability to do so.
Great. Well, thank you so much to all of the panelists for your excellent responses and presentations, and to the people asking the questions for the well-informed questions. It's great to have a conversation like this around such a topical subject. Thank you to the presenters for taking the time away from your busy schedules for this presentation. Our next presentation is Dr. Leonardo Tresande on simple ways patients can limit exposure to EDCs. Dr. Tresande is a leader in children's environmental health. His research focuses on identifying the role of environmental exposures in childhood obesity and cardiovascular risks, and documenting the economic costs for policymakers of failing to prevent diseases of environmental origin in children proactively. He also holds appointments in the Wagner School of Public Service and NYU's College of Global Public Health. He is perhaps best known for a series of studies published in Lancet Diabetes and Endocrinology and the Journal of Clinical Endocrinology and Metabolism that document disease costs due to endocrine disrupting chemicals in the US and Europe of $340 billion and 160 billion euros annually, respectively. After receiving his bachelor, medical, and public policy degrees from Harvard, he completed the Boston Combined Residency in Pediatrics. Thank you for being here with us today, Dr. Tresande. Please go ahead.
Thanks for having me. So I have the great privilege and honor to having followed many of my great and respected colleagues in the field, as well as a panel that already started to begin to touch on safe and simple steps that really should be part of the mainstream guidance for healthcare providers to give to their patients. As background, when I started my career in medicine, that was in the early 1990s, the average medical curriculum around environmental health was a couple of hours in the entire 4 years of medical school. And the reality is that hasn't changed a whole lot. Maybe with the emphasis on climate change, that has evolved a little bit as people are calling for greater knowledge and action on that front. And at the same time, most of the environmental health education it focuses on climate change, perhaps increasingly now air pollution and childhood-led exposures, really and maybe occupational exposures, as the exposures that can be preventable. So it's fair to say that EDCs don't make it to the conventional medical curricula. Probably a big part of that is that we don't prescribe our way out of EDC exposures. There's not a pharmaceutical or a drug for that. We chelate lead exposures at very high levels, well above what we understand to be effects of concern in the general population. But at the same time, there's huge opportunities across the lifespan for prevention. And, one of the things I want to establish up front as guidance that I think is really crucial, and it's a counterpoint to what a lot of people say to me, especially in adulthood, about their past EDC exposures is that there's so much you can do now to prevent exposures of concern that contribute to disease and disability going forward. A lot of people tell me, well, I was exposed to DDT and DES and a host of nasty chemicals of concern that are banned or are about to be banned. And so I'm already hacked in my molecular signaling in a way that really doesn't bode well for my ability to modify my chronic disease risk going forward. If you've taken something away from the discussions we've had so far, there are both many chemicals of concern, many emerging chemicals of concern, but frankly, the most important point is that there's a lot of low-hanging fruit. And a lot of the exposures we're talking about can be quickly reduced and ameliorated. And insofar as you take the steps now to reduce exposure, there are short, medium, and long-term benefits of sustaining those kinds of interventions that can have positive impacts in all sorts of ways. The general way of thinking about it is that if I draw blood levels of some of these chemicals, especially measuring urine levels of some of these chemicals, you can see rapid changes in days. You can see hormone level changes in weeks. I don't recommend that as part of the routine clinical potpourri of tests that we would offer, but it's something that we know happens in the human body, is that there is a recalibration in response to a host of exposures that throw hormones out of sync. And then in terms of chronic disease profiles, there's a reduction in that profile of risk in the long term that has sustained benefits. So let's get into the nuts and bolts, at least what I suggest in talks I give, in the book I've written, Sick or Fat or Poor, as well as just in my own clinical practice in pediatrics, but I think it applies to women's health and frankly all of us. A lot of these steps really run across the entire continuum of exposure. And typically I focus on 5 categories of exposure: pesticides used in agriculture, phthalates used in personal care products, cosmetics, and food packaging, bisphenols used in aluminum can linings and thermal paper receipts, flame retardant chemicals used in electronics and furniture typically, and the PFAS, the nonstick chemicals, used in oil and water resistant clothing as well as in cooking materials. So maybe let's take them one by one for a minute, and then I'll wrap up and just see if we have questions and comments. So eating organic has been proven to reduce pesticide levels in urine and this is important, not just in high-income populations or well-to-do populations, in low-income populations as well. And the interventions we're talking about here, I didn't routinely talk about, admittedly, 15 or 10 years ago, because the price profile for organic food was much higher than that of conventional food. And as market share increased, that price margin narrowed, such that now in the big box stores, you're seeing organic food side by side with conventional foods as options, and not with much difference in the price point. It's important to also emphasize there are Dirty Dozen and Clean 15. Thank you, Environmental Working Group, for putting those lists together. But the TLDR of generally where fruits and vegetables fall among the list of concerns are the ones that are leafy, where the pesticide residue falls in a place where you eat the layer, as opposed to avocados and some of those harder rind fruits and vegetables where you don't typically eat that outer layer. And so there is a barrier to the area where you actually eat. It's fair to say that there is a phenomenon of magnifying foods in the diet. So if you're eating animal products, there can be accumulation of these pesticides ultimately in meat and poultry. That's a little harder these days because the price points are still quite different. But at least as a first step, focus on fruits, leafy fruits and vegetables in particular, where you eat that outer layer. So just moving on from there, when you talk about phthalates and bisphenols, I treat them together because really those are chemicals that are most directly related to plastic. And even here, my advice has evolved quite a bit over the years, because not only phthalates and bisphenols and PFAS are plastic chemicals used in plastic materials, but there are all sorts of non-intentionally added substances that are potentially of concern. So, when we're talking about phthalates, bisphenols, and PFAS, those are just part of the problem. So fundamentally, it's just that we know more about them. Fundamentally, we need to think about reducing our plastic footprint, which has ecological benefits and also reduces carbon footprint. So glass and stainless steel are obviously alternatives to consider. I've got my prop for today in that regard. But if you are going to use plastic, there's some points of departure that you need to be wary of. So microwaving and machine dishwashing plastics are a way to invite chemicals that are not intentionally bound, in particular to absorb into food. And polymers can break down into monomers at high temperatures, so there can be residual single monomers, the bisphenols being a good example, that can resorb right into food as well that way. There are certain recycling numbers generally to avoid. The market has already driven the manufacturing in a way that this has changed in a really positive front, but the numbers to avoid are 3, 6, and 7. 3 are for phthalates, 6 are for styrene or polystyrene, which is a known carcinogen, and 7 are for bisphenols. I appreciate there are some plant-based plastics in the number 7. I think there's some concerns and controversies about what's in that 7 mix that might not be so bad. So it's fair to say it's best to avoid the 7 across the board, which includes the polycarbonate plastic. And when plastic is obviously misshapen or warped or scratched, that means you've broken down some of that protective coating in design, and it's time to throw that away. Just a little point of emphasis on bisphenols in particular. Avoiding canned food consumption is an important way to reduce exposure, and also avoiding contact with thermal paper receipts. E-receipts are a good way to go. I feel badly for some of our folks who are working directly with thermal paper receipts all the time. You're seeing some progress in Europe, particularly where they're bisphenol-free thermal paper receipts starting to go into circulation. And then I'll close with just some comments about persistent organic pollutants like flame retardants, particularly the brominated flame retardants. They accumulate in dust, so using a wet mop and vacuuming can reduce a little bit the dust accumulation, but also recirculating the air in homes. I mean, I think with COVID and with the Canadian wildfires, there's been more emphasis on the need for better air circulation and filtration. The effects there are real and important. And so there needs to be an ongoing emphasis on the indoor environment as a pathway to exposure to these chemicals of concern. And finally, when it comes to nonstick chemicals, cast iron and stainless steel are great alternatives and not necessarily more expensive than some of the nonstick cooking materials that are widely out there. Does it mean you have to throw them out? It'd be a good idea if you could replace them with cast iron and stainless steel. If you could, a little bit of extra olive oil has some additional benefits on the dietary front. So it may take a little more work to scrub those or clean those types of cookery, but it goes a long way and reduces your PFAS exposure in that context. So I'll stop there, hopefully back on time, and I'll check out the chat and see if there are any questions.
Thank you, Dr. Tresande. It was an excellent presentation, and we appreciate your time. While we're waiting for a few questions to come through, I'll start with one. How can patients and just the general public, but particularly women and particularly African-American women, as we know that they're particularly affected. How can they structure approaching limiting their exposure to EDCs? And is there a good first step for them to take?
So it's a great question. I've given you the 15-minute version. There's probably a 2-minute version of safe and simple steps to reduce EDCs. By the way, they don't need a PhD in chemistry. They don't have to break the bank. A cosmetic reading label intervention got plastics down in a low-income Latina population of young girls successfully in days. It's hard to pick 3. It depends by the person and what their lifestyle choices are at baseline. I think that eating organic is something for a few things that can really be a nice bite to chunk out. Also, avoiding microwaving plastic or just reducing your plastic footprint is another way as well. I think those would be my first couple, but really, as I'll tell you in clinical care, you really have to focus on 1 or 2 things at a time and just pick them, get them right, get them sustained, and build off them.
Excellent. Thank you. This is very simple, and that's a great way to start. We have a couple of questions in the chat. First question, is there any research surrounding safe food refrigeration, especially considering the plastic in refrigerators?
So that's a great question. There's a lot we don't know, but it's fair to say that if you can use aluminum foil wraps or glass containers, that's just a prudent way to avoid plastic footprint and plastic impacts on human health. So that is probably the extent of the advice I can give. What I do, if I get something in a plastic container that I don't really have a choice and I need to heat it up or defrost it, the very least I do is take it out of the plastic container, put it in a glass container, and work from there.
Excellent. Thank you so much. We have another question about the biggest sources of exposure to PFAS are water and food. What can we do to reduce exposure to PFAS?
Well, it's a great question. I think the biggest step that I would suggest is focusing on cookery in particular. One of the things I did not emphasize in the talk about nonstick pans is when you start to see wear, it's just like plastic that's worn. It is definitely time to get rid of that, because you are really inviting whatever is on for the ride in that manufacturing to get right into your food. We don't have nonstick cooking at home, period. It's stainless steel or cast iron. So sometimes you can get them for free if relatives have those old cast iron materials available.
Yeah, that sounds like a creative way to address your exposure to EDC. We have another question here asking you to comment on the effects of sweating on the release of VOCs and toxins.
So I think that's still an area where we need more research to back up the action. It's true, I've seen observations that you can detect EDCs in sweat, but does that mean that you are providing a human health benefit? Hard to say, because then you're mobilizing EDCs that are stored in other spaces and getting them into the bloodstream secondarily. And I don't really know what you're getting as a benefit in the context of potential cardiovascular effects that you have to watch out for. So it's still an area of unproven interventions. So compared with all the interventions I've described, which are more backed by direct intervention data, I think this is an area where we need to do some work.
Excellent. And we have I think time for one more question. The asker drinks Fiji bottled water, which is BPA free. Does she still need to remove to go to glass?
So I think this is an opportunity to emphasize that BPA-free is not necessarily bisphenol-free. There are 140 now replacements of bisphenol A out there. BPS is as estrogenic, as persistent in the environment, and as toxic to embryos. And already human epidemiologic studies have shown effects of BPS, including on diabetes in adults. So that's the first comment I would make. I really try to avoid buying plastic water bottles, period. In some parts of the world or on an airplane, if that's the only way I can get my hydration, I get it. Don't get me wrong. But there are a lot of options now. And the more we push market share to glass, the more we'll see sustained momentum in that direction. You see it in certain parts of the world where it's just gauche to use plastic as your water bottle carrier. It's old school glass containers. And there was a time growing up where that's what I saw.
Great. So we're a few minutes over time, so we will stop here. Thank you so much, Dr. Shasande. This is an excellent presentation and very timely for your listeners and watchers at this point. So thank you so much.
My pleasure.
At this point, we'll turn to a video on addressing EDCs by the Reproductive Health National Training Center, which receives funding from the HHS Office on Women's Health and the HHS Office of Population Affairs. After this brief video, there will be a break until 2:45 p.m. when we will return with a panel on work across the government.
Understanding endocrine disruptors and fertility. This video was created by the Reproductive Health National Training Center, RHNTC. Scientific evidence emerging over the past 20 years suggests exposure to toxic environmental chemicals before and during pregnancy can affect reproductive health across the lifespan. Endocrine disruptors are a type of toxic chemical in our environment that are potentially linked to infertility, miscarriage, and other adverse reproductive health outcomes, although this is not known for sure. More information is needed. Growing concern about these potential harms has led to increased research efforts to examine how exposure to endocrine disruptors. So, what are endocrine disruptors? They are natural or human-made chemicals that interfere with the body's endocrine system, which makes hormones and sends them throughout the body. Hormones are chemical messengers secreted by glands. They regulate many functions in our bodies. Hormone or endocrine disorders occur when a gland produces too much or too little of a hormone. An endocrine disruptor can mimic the body's natural hormones or alter the production of hormones, decreasing or increasing normal hormone levels. This interference with hormone action can affect the thyroid gland, brain, and reproductive organs, as well as the metabolic and immune systems. Disruption of normal hormone function can result in endocrine disorders and interfere with fertility. Some research suggests an association between endocrine disruptors and changes in reproductive-related hormones, such as estrogen, gonadotropin, and androgens. Other research suggests an association between endocrine disruptors and fertility. This includes potential negative impacts on sperm concentration, count, motility, and vitality, as well as on egg quality and quantity, ovarian response, menstrual cycle length, and blastocyst formation and implantation. Endocrine disruptors are common in our environment and can be found in everyday products. We can be exposed to them through the food we eat, the air we breathe, the water we drink, and the substances we touch or put on our skin. Examples of endocrine disrupting chemicals include bisphenol A or BPA, dioxins, phthalates, and polychlorinated biphenyls or PCBs. These chemicals are found in plastics, food and beverage packaging materials, many types of nonstick pans, cosmetics, personal care products, fragrances, toys, flame retardants, and pesticides. While exposure to these chemicals is widespread, certain communities are disproportionately affected because of where they live or work. Although exposure to endocrine disruptors is common given their widespread presence in our environments, we don't know how much exposure is too much. And not everyone who is exposed experiences negative impacts on their health. More research is needed to understand the potential impact of endocrine disruptors on reproductive health and fertility. Family planning providers can take steps to screen clients for exposure to toxic environmental chemicals and counsel clients on reducing their exposure. Given the central role hormones play in fertility, pregnancy, and human development, screening and counseling during the preconception and prenatal periods is especially important. Ask clients about their exposure to toxic chemicals in their workplace, home, and recreational activities. Counsel clients on limiting their exposure by avoiding or minimizing the use of products containing known endocrine disruptors, such as BPA, phthalates, and parabens when possible. Actions that can reduce exposure to endocrine disruptors include use non-toxic products, such as vinegar and baking soda, to clean your home. Vacuum regularly and use a wet mop to prevent dust from accumulating. Don't spray bugs or use pesticides. Instead, try baits and traps to keep insects and rodents out of your home. Minimize the use of personal care products, cleaning products, and laundry detergents that contain fragrance. Wash fruits and vegetables to remove pesticide residue. Minimize consumption of canned food. When possible, choose fresh and frozen food. Try to avoid heating or cooking food in plastic containers. Avoid using non-stick pots, pans, and other cookware. Frame these actions as opportunities to reduce exposure when possible. Acknowledge that all actions may not be feasible most of the time, or at all in some cases. Some individuals and communities may have limited control over their exposures to endocrine disruptors. Emphasize that small steps add up. For more information and to find related resources, go to rhntc.org.
Produced by the U.S. Department of Health and Human Services.